Hi, I'm Kim, and I'm the nurse that will be speaking with you today. I have to admit that I'm not very good at this public speaking thing, as evidenced by this is the 5th or 6th time that I have attempted to record this message. So I do have some notes here that I will tend to glance at, and I apologize for that. I would like to start by discussing the opioid crisis. I currently work in perioperative services as a circulator/scrub nurse in the operating room. I see the effect that drugs has on the patient population every day. Patients arrive with infected abscesses, poor oral health, damaged heart valves due to drug use. And let's also consider the high incidence of hepatitis C and HIV in this patient population. So when you work in healthcare, you see this crisis as a reality more bluntly than those out in the community. As a society, we tend to get busy with work, school, family, other obligations, and it is unfortunately all too common to have no idea that you've lost touch with what goes on in your own neighborhood or backyard. The evidence of this crisis is seen every day in healthcare facilities, and it's truly maddening. Opioids are killing our friends and family. Addiction is taking mothers and fathers, brothers and sisters, friends or acquaintances away from us. Babies are being born to addicted mothers, and if they live long enough, they will struggle harder in their first months of life than they should have to in their entire lives. If your family has been touched by an opioid addiction, you are all too aware that it is a battle of ups and downs, hopes of rehab, but even if successful, the possibility of relapse. The experience families and friends go through is truly heartbreaking. I'm currently watching my roommate go through the loss of a friend due to an overdose. This friend had been through rehab and seemingly had his life back on track and was pursuing a bachelor's degree. He relapsed and as a result, overdosed and died. As a friend, it is a helpless feeling. You always feel that there was something that you could have done or said differently, and that is what my roommate is feeling now. I feel so bad for my friend and the emotions he is going through. Addiction is everywhere. It's in every city and in every small town. I read an article the other day describing children as young as 8 who were inquiring about learning how to administer naloxone to addicts in their own families. There is a group in northern Kentucky that aspires to do just that. This is proof that the opioid crisis drastically hits home. This article was published in 2015 and was titled "Kids to be Trained in OD Reversal Drug." The upside of this situation is that these kids realize that drugs can kill them. It is hopeful that these children will never use. It is thoughtful that the administration of this drug might be traumatic to the person administering it. One of the contributors to this article adds that teaching kids to administer naloxone can prevent the trauma experienced by watching a parent or loved one die. This article goes on to explain that if someone ingests naloxone and has not been using heroin or opioids, there is no effect. So in essence, the children that administer naloxone cannot hurt themselves. The children are also instructed to find an adult first if one is available before they administer the drug. There is much proof that the opioid addiction is real. The true issue is how to combat this situation. NSAIDs are the most commonly prescribed drugs for pain, obviously, because they are non-narcotic. In some patients, especially those with chronic pain, NSAIDs just don't do the trick. According to Russell and Kopelman in their article, Acupuncture for Pain, there has been extensive research on acupuncture for pain management over the last 60 years. It is suggested that acupuncture activates the body's own opioids as well as the brain's sensitivity to them. In their study, patients taking opioids were in more pain at 12 months when compared to another group of patients who were undergoing acupuncture also for 12 months, and that group continued to report benefits of the treatment. Fan et al. Claims that acupuncture is most effective in back, neck, and shoulder pain, chronic headache, and osteoarthritis. It has also been seen to be beneficial in perioperative pain management. In a study provided by Fan et al., a trial of acupuncture versus morphine was conducted. Acupuncture provided faster pain relief and was better tolerated. Acupuncture also decreased the amount of morphine used by addicts in the trial. Inpatient and outpatient results related to acupuncture explains that it aids in the alleviation of acute and prolonged drug withdrawal. It can be used as a method to reduce the stress and anxiety due to these withdrawal symptoms and aids in the prevention of a relapse. I created a teaching outline as well as a teaching handout to go over with patients. Both of those are attached, by the way, if you want to take a look at them. The title of the presentation is Use of Acupuncture as a Non-Pharmacologic Method for Pain Management. The target audience, I would like to present this material to patients aged 18 and older who are being treated in a pain management clinic. These patients are experiencing some form of acute or chronic pain. Patients with acute pain have been prescribed mostly NSAIDs with a small percentage receiving a narcotic. Those with chronic pain have been receiving narcotics for a year or more. Patients have been required to try physical therapy or chiropractic services and instructed to perform exercises provided by those services. All have used heat or cold for pain relief. Very few have tried any form of herbal medication, and none of these patients have ever tried acupuncture as a relief for their pain. So the goal of teaching or the learning plan is at the end of this presentation, the patient and family will acknowledge a possible new alternative for their acute or chronic pain. Specific learning objectives I had listed according to domain. For the cognitive domain, that I would like for the patient to list at least 3 benefits of acupuncture for their acute or chronic pain by the end of the visit, and that the patient will judge whether acupuncture could be an acceptable pain alternative for them by the end of that same visit. For the affective domain, the patient would accept written information about acupuncture by the end of the visit. Hopefully my teaching handout would be an example of that. The patient will also share one possible barrier to using acupuncture as a therapy for their pain management by the end of the same visit. For the psychomotor domain, the patient will use internet resources to locate acupuncture providers in proximity to their location within the next week, and the patient will schedule an appointment with an acupuncture provider by the next office visit. So how do we know that any of this teaching has worked? The evaluation techniques are also listed according to domain. For the cognitive domain, learning will have occurred if the patient is able to identify the benefits of acupuncture and verbalizes if they think it will work for them. For the affective domain, learning will have occurred if the patient accepts the information, for example, the handout, and is willing to share possible barriers to this treatment. And for the psychomotor domain, learning will have occurred if the patient contacts and schedules an appointment with an acupuncture provider. And of course, this is also if this is financially feasible for this patient, because patients have different insurance and financial needs. So the handout looks kind of like this, very basic. I'll let you take a look at it. I tried to include a lot of white space. So it starts here at the top with this nice picture that gives the patient an example of what the acupuncture needles look like, in case they've never seen anything like that before. Then we start over here with, did you know that research shows that acupuncture therapy is beneficial in the reduction of many pain types? And I've listed some examples, which are headache, low back pain, osteoarthritis, neck pain, shoulder pain, perioperative pain, and also withdrawal symptoms, which I think is very important to add. So a lot of these patients, if they're experiencing chronic pain, they probably, and have been taking opioids for extended periods of time, they probably have some concerns about if they're going to be, if there will be some withdrawal symptoms from their medications. So key things to know about acupuncture is that desired effects may take several weeks. It would be wonderful to explain to this patient with chronic pain that this is a great alternative for them, but they need to understand that if they've been experiencing pain for several years, that one visit is not going to be a quick fix. So they need to realize that the desired effects may take some time for like the true effect to be established. There are minimal risks with professional therapists. Acupuncture therapy may not be for everyone, especially like if someone's afraid of needles, then this is not going to be something for them. We don't want to add fear into the equation. Things to consider, I have over here in this box, like please consider. Ask your healthcare provider if acupuncture is a good option for you. Any type of pain management needs to be discussed with your healthcare provider. And, you know, some patients may not be candidates for acupuncture. For example, if they have to take blood thinners, or there's other medications that may contraindicate this type of therapy. So those need to be discussed with the healthcare provider. Acupuncture should not replace recommended medical treatment, for example, physical therapy or a chiropractor. If your healthcare provider sees that there are benefits from those types of therapies, acupuncture is a therapy to be used in conjunction with those, not as a replacement, unless it's directed by your provider. You can ask your acupuncture therapist about their training and experience. Acupuncture therapy may not be covered by your insurance provider. So those are all things that need to be considered when discussing acupuncture as a form of non-opioid pain management with your patients. I feel like we tend to use other drugs when treating a drug problem, and that really doesn't seem rational. Based on the research, non-opioid forms of pain management can be just as effective, if not more effective, in the management of acute and chronic pain. Non-opioid forms of pain management are a much safer alternative for the patient, and acupuncture is just one example of the alternatives out there that are available. I really enjoyed researching this topic. I am interested in acupuncture myself. I consider it myself as maybe like a stress management tool. So I really enjoyed it, and I thank you so much for listening.